All right. Hi, everyone. I am Yolanda Harper, co-founder of Harper Therapy, and I'm here today with Chris Long, who's a licensed clinical social worker. And at Harper Therapy, we are really passionate about sharing some helpful information during COVID-19. And today we want to specifically talk to first responders, healthcare workers. Now, at Harper Therapy, we specialize in trauma and anxiety. So we have an understanding of what things are looking like right now for you and how there's some anticipatory, like pre-trauma experience of knowing what your lived experience is now right there on the front line and then seeing the tidal wave that's coming down the pike. Is that right, Chris?
Well, absolutely. And Yolanda, I wanted to just kind of almost build on that because I love the way you identify the potential for the trauma. But I want to take it a step further. Okay. I believe with the situation that we have going on now, it almost creates a perfect storm for trauma because it's not just the physical or the acute incidences. Okay. Right now, we've got extended work hours. We've got low perceived safety precautions. We've got unpreparedness, lack of resources, okay, and lack of long-term information. We really don't know a lot about the situation, okay? And first responders, the people we rely on to be in control, okay, these are the ones that are subjected the most to it, okay? So it really sets the stage, okay, for that trauma, for that burnout, for that secondary trauma.
Well, and you and I were talking before we started recording that this situation in particular, this pandemic, hit so close to home. Now,
Absolutely.
these professionals work in their own communities anyway, but we're hearing stories of healthcare workers having to intubate their colleagues and those kinds of things. So it is hitting especially close to home, which further precipitates the propensity for there to be a traumatic response to these situations.
Absolutely. It's real and it's close to home, okay? And when we look at some of the signs, okay, and it's important to recognize them because they present or manifest themselves in different ways to different people. Sadness, depression, apathy, anger, frustration, irritability, lack of feeling or indifference, even kind of letting some of those self-care, okay, things go, hygiene and stuff like that, physical appearance, okay? But there's also another portion to it, okay? And the other portion is some of the internal stuff, okay? That is more likely to hit self-responders. Feeling like a failure, feeling like nothing you can do is helping, okay? Using drugs or alcohol or increasing those things to mask some of those feelings, okay? Those are all things that can the potential is there for, okay? But also even the would-haves, could-haves, and should-haves. I could have done more. I should have done more, okay? I need to work more. I need to work harder, okay? I can fix this, okay? Those are all feelings that are very, very normal, okay? And can really become distorted and become problematic.
Right, yeah.
But even just kind of looking at things to kind of keep in mind, okay, and to remind yourself of, okay, especially for our first responders and healthcare workers, okay? Number one, it's not selfish to take breaks, to take a deep breath, to take the time that you need, okay? And that the needs of others, okay, are not more important than your needs, okay? And I want to stop that for a second, okay, and go to oxygen mask theory. If you're on a plane that's going down, put your mask on so you can take care of others. We need you. Okay. And that's just one of those things that self-care has to happen. Okay. Because guess what? Your colleagues, your support systems, there are people around you that will jump in and help you out.
Well, and it's a reminder that we actually are able to come back from stepping, when we take that oxygen mask break, when we take that step back, we're able to come back to our job, to our work, to the things that are most important, more effective. We're better versions of ourselves. We're less likely to make mistakes, less likely for these situations to kind of embed themselves as traumatic experiences, right?
Absolutely.
When we do what we need to do to calm the nervous system, there's less likelihood that down the road, this is going to linger.
Well, and what you said right there is paramount, calming the nervous system and letting it go, because it's the buildup and it's almost that burn, okay, in the brain that imprints itself and
Yeah.
quote, there's the trauma. And it keeps us in that loop where we go back and forth and back and forth. Sure.
Yeah, that's the definition of trauma itself, is these things that are so heightened in our nervous system that the brain stores those events in our, in our memory as these traumatic experiences.
Absolutely. And the key there is it's not just the things that we see, it's those emotions, the deep emotions that we experience as well. Okay. And the moral trauma that's attached to it. Okay.
Yeah.
And it's real. Okay. Don't think for one reason, for 1 minute it isn't. Don't think it's a sign of weakness. It's not. Okay. It's just what you need to do to keep yourself healthy to take care of others.
So what are some other tips for our healthcare workers and first responders so that this doesn't impact them long term?
Well, again, the first thing that I'm going to tell you is self-care is essential, okay? And it doesn't mean you have to go to a spa, okay, get a massage, have your nails done, okay? What it means is you need to be able to take that time to reflect. You need to take that time to debrief and to de-escalate, okay? Along with that goes relationship, okay? Being able to relate, talk to, okay, and be with others. We're wired for the tribe, okay? That's one. Connectedness, being able to connect, to let things go. And sometimes by voicing them, the person doesn't have to have a solution. Okay, voice it, let it go. I can now move on, okay?
Yeah.
And the other thing too is assigning meaning to events, okay? Look, in the grand scheme of things, everything happens for a reason, okay? And I know that may sound like rationale, but it's not. Faith, acceptance, and hope are paramount to be able to assign meaning events and to move forward from them.
Yeah, and I really love the fact that you talk about connection and tribe. We do a lot of work with trauma and with combat veterans, and what we know is that with trauma, the people who have that support system have a greater likelihood of moving through these events in a healthier state of being. Right? It doesn't make
Absolutely.
it easy peasy. So keep that in mind too. Stay connected with your support system, with your colleagues, with your coworkers, with your families. And that's especially difficult too, because a lot of our healthcare workers and first responders are having to isolate from their families just to keep them safe.
Right.
So find the ways to stay connected.
Absolutely. Absolutely. Essential. It's essential.
Yeah. Any other tips, Chris, for our healthcare workers and first responders?
Yeah, the other thing too is I encourage you, as fearless as you guys and as unselfish as you men and women are in your pursuits, okay? I want you to recognize, okay, that you need to be just as fearless in the pursuit of your own self-care and your own self-health, okay? And if there's anything that we can do for you, okay, we're here to help you.
Yeah. First responders and healthcare workers, we love you. We are cheering for you. We appreciate you. We want you to have a plan for your well-being, for your not just your physical and health well-being, but also your psychological, your emotional, your relationship well-being. If we can help with that, please let us know. And yeah, thank you. Stay safe, right?
Well said, Yolanda.
Yeah. All right. Thank you, Chris, for your tips and for your insight and wisdom. And everybody stay safe. Take care of each other. Have a good day.
Take care.